The following is an exclusive presentation of Optimum. We're your TV, phone, and internet company.
This year, the flu season started early and is epidemic throughout the United States.
But what can you do to help prevent the flu and stop the spread?
We have answers on this week's Health Talk.
We're up next.
Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today we're going to discuss influenza, the disease influenza. Our guests are Dr. Paolo Pino and Dr. Julie Varughese. I'm going to get this right. They're both infectious disease specialists with the Norwalk Medical Group. We're back, and with us are Dr. Paolo Pino and Dr. Julie Varughese, both infectious disease experts and experts in the flu.
Thank you again for being here. So, Julie, one of the things we really want to highlight in this show is the flu shot, the flu vaccine. Maybe you can start our viewers off.
Sure. We definitely recommend that everyone get the flu shot. Some people have asked, is it worth getting it still at this point, or if I've already had the flu, should I still get the vaccine? And absolutely, we definitely recommend that everyone get the flu vaccine. The flu vaccine covers kind of some particular strains of influenza, and it's meant to protect you against particular strains during that season.
And I know we reformulate the flu vaccine every year, and I've heard various people on the media say it is a good vaccine for what's going around, and it isn't. What's the answer currently?
It is. The majority of the strain that is going around, it's H3N2, and there's the H1N1, which was popular a few years ago, and then those are both flu A type of influenzas, and then there's a flu B. So all three of those are in this year's formula. And the majority that is going around at this particular time, the strain is the H3N2,
so
and it is.
Right for that.
It is.
Yeah.
And why it maybe to answer your maybe the other question is why isn't working at this point, or in some patients, is well, as you get older, people's immune systems may not work as well, so they may get the flu or a little bit of a less of an illness than if they were not to receive the vaccine. And then if you've received the vaccine, it does take 2 weeks for it to sort of your body to acknowledge an antibody. So if you're within that period, theoretically, you can still get the flu during that 2 weeks.
So you also hear that the flu vaccine is only 60% effective, or 50 to 70%. But what you're saying, and I'll ask Julie this question, we're really saying that group that does get the flu and have had the vaccine usually have another problem, but they still get a weaker case of the flu. It's still worthwhile. Am I correctly interpreting that?
Yes, absolutely. It's still worth getting the vaccine. They might have a milder case of it, or there are other strains that might not necessarily be covered in the vaccine. But the vaccine, as Paul mentioned, currently is very highly protective against the particular strain H3N2 that's going around in this particular season.
And Paul, part of the reason to continue to get the vaccine, even kind of while we're in this epidemic, is that often there's a second peak of flu in a season.
Yeah, I mean, traditionally, this specific year's flu season started about a month earlier than traditional, but it can go as late as May. And then this is a seasonal flu, as opposed to the pandemic a few years ago, which was the H1N1, which was internationally, and that was a flu strain that hadn't been seen, or a strain that hadn't been seen in quite some time, if ever, at least in our generation. So, this year's is more of a seasonal type of flu, and more of the patterns that we have seen, albeit it's just a little bit earlier than we've seen in the past.
I heard it's also more severe this year. Is that true?
Yeah, I think it hit a little bit early than usual, maybe as far as that's concerned. But this can go on as late as May. That's what our seasonal flu usually is.
And Julie, because it has more than one strain in the flu shot, it still is worth getting the flu shot even if you've had the flu.
Absolutely. One person might have one particular strain of the flu that caused illness, and they would still be protected against a couple of the other strains that are in the vaccine.
Now, one thing I hear, and I know that it's not true, except we'll get into the nuances of it, but people say, well, the flu shot gave me the flu. The typical flu shot we use, that's impossible, isn't it?
The flu vaccine is an inactivated vaccine, or it's a dead virus that's used to make the vaccine. So theoretically, one should not be getting the flu from the vaccine. But as Paul mentioned, there's a kind of a 2-week window period before your body starts to make antibodies. So it's possible that during that period, one could get sick. Or sometimes people mistake getting the common cold as getting the flu from the vaccine.
Just sometimes people get a little immunologic boost from reaction to the flu vaccine that makes them a little achy for a day or even a low-grade fever.
Yeah, I think that's true with any vaccine, but yes, I think that's possible. A little malaise or a little fatigue or something for a day or two. Muscle soreness.
Much less severe than actually getting influenza, so people should still remember that.
I think there are a lot of myths out there, and that's one of them. There is no live flu in this attenuated virus, the shot that Julie was discussing.
Now, there's an inhalational virus that's approved for kids, and maybe you could say a few words about that.
That is a live vaccine, so it's different than the inactivated shot that most people are getting as the flu vaccine, and that's, I believe it's for kids from the age of 2 to all the way to the age of 49, and it's not recommended for certain higher risk populations.
2 to 49.
Yeah, that is a live vaccine. So the patients who may be on chemotherapy or some immunologic problem, that's not really the vaccine for them. But most of that is in patients who may not want the shot just because it's a shot, so they can get the flu.
Now, I have read that overall it's less protective than the dead vaccine. Is that true?
I think in a few years ago with the H1N1 that they saw that the inactivated shot was more effective. I personally would prefer the shot versus the mist, but some patients just don't like the shot part of it and would prefer the mist.
Now, in the past, groups like the CDC had recommended the flu shot for various age groups, and in recent years they've really opened that up and said almost everybody should be eligible for the flu shot, right? But certain high-risk groups should really, really be thinking about it.
So the recommendations have changed, and they did, when there was a pandemic, they did sort of ration these. I don't know if that's a good word to use, but they said the pregnant women, very high-tiered patients on dialysis, high-tiered were highly recommended, and these are the first patients to get those vaccines. And then maybe younger patients who didn't have these medical problems were sort of on the second or third tier of that. And they sort of, that was a unique circumstance. And they sort of changed, they've been changing their viewpoint on this, but at this point, anyone with the age of 6 months and up and above, it's really is recommended.
Yeah, and I think we've all in this room gotten the flu shot, so we're walking the walk. We're running out of time, but we do hear a lot about Tamiflu, which is an antiviral treatment of the flu. Julie, maybe you can say, what role does that have in treating or preventing the flu?
Tamiflu is best used earlier on in the onset of symptoms, often within the first 48 hours of symptoms beginning. As you said, it's an antiviral medication that often helps with kind of shortening the course of the symptoms that one develops from influenza.
Is it for everybody?
I would say it's best for kind of higher risk populations that we've already discussed, and in some instances it could be used as a prophylaxis as well.
So this you might use for family members in a household.
Right, that have had high exposure.
So it's not a panacea, it shortens the flu, it doesn't make it go away immediately.
No.
But it has a place in our armamentarium. We have just a few seconds left. Any final words to everybody out there?
I would say get the flu shot. It's still not too late, and I would highly recommend everyone who discuss it with their doctor and with their family. If it's not for you, maybe consider someone you're babysitting, your grandson. Do it for them.
And plan to get it next fall too.
Absolutely, every year.
Every year.
And it really is every year a flu shot. Protect yourself, but protect each other as well.
Absolutely.
It's very, very helpful.
Thank
We're
you.
going to keep our guests on the set, and when we come back, we will answer today's health question.
But for now, stay tuned for some of the upcoming events sponsored by Norwalk Hospital. This week's health question comes from one of our viewers. And the question is, what is the difference between the flu, bronchitis, and a cold?
So we've talked a lot about the flu, and I think hopefully we've emphasized what those symptoms are. So Julie, we'll start with you. So how is that different from a bronchitis?
Oftentimes with bronchitis, there can be a productive cough. Sometimes there will be sputum, which often you don't necessarily see with the flu. It's more of a dry cough, kind of some upper respiratory symptoms that you see with the flu.
And Paul, the common cold?
Common cold is an upper respiratory infection. It's kind of the most general of the three terms, and it typically is a virus, and it may cause a runny nose. Maybe without a fever, you may be able to sort of get through it, but it is probably the mildest of the three as far as its distinction. But the flu is influenza. Bronchitis, as Julie said, is more of a upper respiratory bronchial inflammation with a predominantly cough. Cold may just be runny nose and postnasal drip and something like that.
And as we emphasized before, influenza comes on suddenly. You get muscle aches and fever, often high fever with it, headache. And my understanding again is that though you may get a stuffy nose, it's not as prominent as is with a typical cold. Is that right?
No, it's not. I mean, it's pretty. I mean, the influenza of the three illnesses is typically the most serious and the most for anybody, and the cold being a simple runny nose or something like that could be a cold.
And we've got about 30 seconds left. Should everybody be tested? Because we do have these nasal swab tests for the flu.
Yeah, I mean, some have it in their doctor's offices in the emergency room, but these tests do have a false negative rate. So just because...
Meaning, so if you test it and it says no flu, you still can have the flu.
Exactly. Yeah, and a doctor may want to treat or recommend certain symptomatic treatment despite what the tests would show.
Well, that's really, really helpful, and we are in the midst of an influenza epidemic. I hope that this information has been useful to the folks at home. I hope everybody there has had a vaccine. If you get the flu, remember, protect everyone around you. So if you have a question you'd like to ask on Health Talk, please contact Andrea and me at healthtalk@norwalkhealth.org.
I'd like to thank our guests today, Dr. Paolo Pino and Dr. Julie Varughese. We'll see you next week on Health Talk. Stay well.
Stay well, cough into your sleeve. Bye-bye.